This episode of the Beauté by AVIC podcast is brought to you by Dermalogica Pro. Hello and welcome to the Beauté by AVIC podcast, your online support community for the aesthetic and beauty industry. Here we are strengthening and unifying the industry through representation, innovation and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces and bringing you the latest industry news. This is Beauté by AVIC. I'm your host, Stephanie Miller, and today's guest is Sarah Hughes from Dermalogica Pro. Sarah Hughes is the MediClinic Training Manager for the International Dermal Institute. Sarah has been a therapist for over 25 years, with her area of expertise lying in skin science and skin health. This being the catalyst that led her to gain her associate degree as a dermal therapist. Sarah's passion for skin therapy is infectious, and her knowledge of clinical skin analysis is second to none. Here to discuss treating hyperpigmentation, from Dermalogica Pro, today we welcome Sarah Hughes. Welcome to the podcast, Sarah.
Thank you. It's so good to be here again. Love being here with you, Steph.
I'm always so excited when you're on. We always have a fun and extremely long conversation.
We do have to we have to rein it in, don't we? Because otherwise we're full for the whole day.
We do. We're couple of skin nerds here, but you have been on the podcast a few times now, which is amazing, and you are one of our favorite guests. For the people that haven't heard your podcast before, don't know who those are, but for those people, please tell us a little bit about yourself and how you came to be in our industry.
Oh my goodness, it's actually frightening, Steph, when I look back, because when I was that little college girl tottering around in her white heels and her white uniform with her makeup kit and her beauty therapy kit going to college, it still seems like only yesterday. And yet back in the UK, say I graduated in 1993. So a very long time ago now. So long I don't even want to do the maths. But always just loved being in the industry. I haven't left it except to have children. It's an industry that's evolving and changing. And for me now, the thing I think that keeps me held in is the fact that it's taken a lot more seriously now. Like back in the day, tottering around in my white heels, which I did, but that was our uniform, heels and a little white dress, tan tights, that's the way it was. We weren't taken seriously. We were just those girls that went to college and did that because didn't have anything else to do. Whereas now when you look at our industry, just last year, I graduated with my bachelor degree in applied health science. So I can now have the official title of dermal clinician after 5 years of study. But you know what? Now I feel like as with that, we're taken a lot more seriously. And I think the medical industry is starting to look at how they can collaborate with skin technicians and estheticians. And I think, industry bodies like AVIC and the various other regulatory bodies, etc., are starting to bring us forwards into, we actually know skin. We know what's going on. We know what doctors and dermatologists are doing and the options they have. And then we know how to support when a client has to help with that, have to have that medical intervention, we can support. And I think we're slowly moving into a much more advanced industry. And that I think is so exciting. To be a therapist starting now, wow, how amazing.
It is very exciting. And you said that, you articulated that so well, and really truly reflective of how we have evolved over the past 20 or so years. And yes, absolutely, it is organizations such as AVIC that are pivotal in bringing us forward. But really, it's a movement from the ground up. It's actually a movement from the therapists,
from the cosmetic nurses, from the industry, because this is an industry-driven effort and really an industry-driven body, unlike any other, because it really is for our members, by our members, and is operated by council members. So it is literally us, the industry, doing this for ourselves.
And I think it's incredible. When I first started out, there was no regulatory body, there was no support. You just went out. I mean, some of the clinics that I worked in those early days, the practices I worked in, just on a very superficial level, the practice of not doing a consultation and a skin assessment, because you don't have time. You just got to get that client in, get that client out, sell some products and move on.
Right.
Now you can touch a client's skin without a consultation and skin analysis. And that's because you've got those bodies backing you and supporting you.
But it's also, we wouldn't even be here without foundation members and incredibly supportive supplier members such as Dermalogica. Of course, Dermalogica is a foundation member right from the very beginning, one of the ones that gave us our much needed funding so that we could even exist. And you were talking about drip technology that's been driving our industry forward, and that's brought forward by these incredible organizations and companies that are coming up with such innovative products and innovative equipment for us to be able to use and really upskill and up-level our craft.
Definitely. I mean, when you think of what we have the ability to do now as skin nerds, as we like to call ourselves, there's lasers and IPL machine. I mean, I go to the trade shows and the symposiums and I look at all the technology that's out there and I just get I could drool. I don't control myself, but it's so exciting what a skin therapist can get their hands on now, just to create that change and really feel like we're making a difference. And it's so good to be a part of that industry still.
It really is. And bringing it back to basics, we say what our therapists can get our hands on to treat the skin, but it always comes back to the knowledge of the skin, understanding of its mechanisms, and then the fundamental cornerstone of really what we do and how we treat the skin is the products that we use and the home care that we use, right? In conjunction with the clinical treatments. And that's about what we're going to talk about today.
Definitely. But also, I think taking that one step further, and it kind of leans into what we're going to talk about, how we assess the skin and how we diagnose the skin and things that we've relied on in the past. And are they necessarily the all-saying, all-doing answers, or do we need more knowledge and more support to really get those results for the skin?
That's a wonderful question. It's a very leading question. Well, let's dive straight into it then. We've got one of our favorite topics, and that's pigmentation. It is one of the trickiest, hardest, and most enduring skin concern. It affects all skin types. And it is a tricky thing to understand. There's a lot of factors going on there. The first and foremost is the Fitzpatrick scale. Now, Sarah, tell us a little bit about the Fitzpatrick scale and exactly what are its limitations.
It's interesting that our industry has adopted it, because it was actually formulated or brought to fruition by Dr. Fitzpatrick in the 70s. And he was conducting studies not into skin pigmentation, but into the varying shades of skin and their response to the sun. So the whole purpose of the Fitzpatrick scale wasn't about what we could do as skin technicians. It was just like, if you have blonde hair or red hair and pale skin, you're going to burn way quicker than somebody that's got dark hair and darker skin. And he put it all into a scale. What's really interesting is actually the Fitzpatrick scale, when it first came to fruition, didn't even have the 5s or the 6s. It was literally a 1 to 4. There was no 5 or 6, that real sort of melanin-rich skin. Dr. Fitzpatrick didn't have any interest in that skin. He was just looking at those fairer skins and what happened. And in reality, it still has its place, as therapists, we do use it because we know that those Fitz 1s and 2s tend to be a little bit more heat sensitive. But we've adopted that Fitzpatrick scale for absolutely everything. Should we do a chemical peel on this skin? Can we do IPL on this skin? Can we do a laser on this skin? And I think for us as skin technicians, we look at those more melanin dense skins and we avoid doing so much because we're worried. Oh no, it's a Fitzpatrick 5, it's a Fitzpatrick, I can't do anything. And that's literally not the case. You can treat those more melanin rich skins if you've got the knowledge. And yes, Fitzpatrick helps. There's another scale called the Lancer ethnicity scale that also helps. That helps us to determine our background, but I don't know my full ancestry. I remember the biggest eye-opening moment for me, Steph, was a therapist that came to a training session with me, and we were going to do a peel on her skin. And I'd said, with these peels, we're very, very cautious on those higher Fitzpatricks. And I made some very, very assumptive comment, and I learned from it very, very quickly to this therapist, because although she had dark eyes, she was very, very pale skinned and blonde haired. And I said, well, you'll be okay to have this peel because you've got this beautiful fair skin. And she said, Sarah, my mum and my dad are full Indigenous Aborigine. They have dark skin, dark hair.
Wow.
I just don't have that skin. And you know what? We didn't do the peel on her skin because, respectfully, yes, okay, you might not have what would we call a Fitzpatrick 5 or a 6, but you obviously have the genetics there. And so doing something that could potentially create an inflammatory response or a really strong one, I actually veered away from it. So although Fitzpatrick is good and the Lancer ethnicity scale are good, they all help us, they don't give us everything. We were saying just a moment ago, you've got to do a thorough consultation. You have to look into that consultation card. You have to delve into your client's background. And I think the limitations with Fitzpatrick is that we allow it to limit us. We rely on it as a safety mechanism of, oh no, I can't treat. But when you think of the global population, the Fitzpatricks 1 and 2, we're the minority. The biggest percentage in the population sit between a Fitzpatrick 4 and a Fitzpatrick 5. And we're denying 80% of the population treatments because of a safety mechanism. And I think yes, you need Fitzpatrick. Yes, you need Lancer. There are other things that are coming through, other ways of diagnosing skin, which unfortunately won't be available to skin technicians at this point. They're very much dermatology driven. But I think just being really thorough in your treatment and your diagnosis is going to be more rewarding for you as a technician and for your client as well.
And everything you've just said is really eye-opening, will be eye-opening for a lot of therapists and people listening as well. But I love what you're saying about the consultation process. That's one of the most important parts of it, is asking questions. So if you don't ask the leading questions, you're not going to know the person's background or how they react in the sun, or, a lot of different factors that go into deciding whether or not that treatment is suitable for that patient. And you were talking about diagnostic tools. There are so many great ones. We do have access to better diagnostic tools at the moment, but yes, more is coming. The question is, and I suppose the point is, that you're talking about 80% of the skin population out there who really need treatments to serve them. And I think it's very forward thinking of, I suppose, companies like Dermalogica, who are actually coming out with more suitable treatments for those skin types, because I am seeing more treatments available that are suitable and more, I suppose, just going to be more effective and more gentle on those types of skins. And it's actually really exciting, because it has been a hurdle. I know I've got clinics myself. It has been a hurdle in treating those darker skin types. But as well, there are problems that we experience with those darker skin types further and above just, treating them in clinic. That's at home treatments as well. So tell us, what are those problems that we can experience with those higher Fitzpatrick skin types?
I think the thing we have to be aware of first and foremost is that I think there's a common assumption that when you have a higher Fitzpatrick, you've got more melanocytes. I like to think of it as the factory. They don't have more melanocytes just because they have a darker skin. There's a few things that we have to consider. First of all is the different types of melanin. You've got a dark brown pigment, which is your eumelanin. That gives you your sort of browner tan colors. your darker colors. And then there is another form of melanin called pheomelanin, which gives you the red haired and the blonde hair. And pheomelanin is very much in the minority. It's not the strongest melanin that gets produced. It's not the strongest protein. It's a lot easier for us to produce eumelanin, and all of us have genetic ratios of that. But then within that as well, when we start to manufacture melanin, it's how we package it and deliver it. And in a fairer skin, the eumelanin that's packaged is very, very fine, like a sand or like crushed pepper. And then your Fitzpatrick's 3 and 4, it tends to be more like peppercorns. It's more solid, it's harder to break down, it's more evidently visible in the skin, so that by the time we get to our Fitzpatrick's 5 and 6, we've got this real dense, solidified, really strong melanin package, like a good coffee bean, really, or jelly bean, like really, really strong. And so that pigment is difficult to break down. The delivery is the same, the production is the same, it's the packaging and the genetic disposition to Phe or eumelanin. But the other thing that we have to be aware of, though, is that when we look at that, and if you mentally picture that, if you've got something that's ground pepper and you're trying to treat that, that's quite easy, right? Because it's already weak, it's not strong. And whereas when you're looking at something that's dense and packaged like a coffee bean, it's going to be tougher for us as technicians to treat, because you've got to try and break down a much, much tougher, greater pigmentation. The other thing then, when we're looking at those higher Fitzpatricks, aside from the fact that they've got a lot more eumelanin, it's a darker shade, it's densely packaged, is that when we then start to perform the sorts of treatments that we want to perform on the skin, we trigger inflammation. That's what we're doing, right? When we do a chemical peel, when we do a microdermabrasion, when we dermaplane and do microblading on the skin, all of those sorts of treatments can trigger an inflammatory response in the skin. And when we trigger inflammation, we trigger that initial sort of wound healing response, particularly if we're needling or we're performing lasers. And historically, when you do that, and when you trigger the innate immunity, you can trigger the melanin producing cells, you can trigger the melanocyte, and it can go into overdrive. And so as much as we want to treat those greater Fitzpatricks, you've got to have a really good foundation level of what you're doing and how you're potentially triggering that post-inflammatory hyperpigmentation. And are you going to be doing that? And I think that's kind of what's really held us back in the past, is that we've had therapists that have wanted to treat, and with the best will and the best intentions, they wanted to get results, but they haven't been able to, or they've made the problem worse. Just not having that foundation knowledge. So pigmentation, you can treat higher Fitzpatricks, and you should treat them, but you might just need to have a slightly different approach to how you're going to do it. Is a chemical peel the best option? Is the sort of acid that you've chosen the best option? Is there a better one? Can you do IPL versus laser? What are you doing with that laser? Because if you're using a laser that's targeting a chromophore, what chromophore are you targeting? Water, blood, melanin being the third one. So it's having all of that underpinning knowledge. And I think that is the hardest thing about treating a Fitzpatrick skin that's higher than a 4, is do you really know what you're doing?
Well said, well said. And then you touched on so many different things there. And of course, every therapist's nightmare is recalcitrant pigment. You go in, you treat, it looks good, and then a little bit down the track, it rears its ugly head and it's even worse. How do we overcome that? And sometimes you don't even know that it's happening until, a period of time after. And you were talking about how to treat it. Do you treat it with laser? Do you treat it? There's lots of information out there now that are saying go low, go slow, do more frequent treatments and combination therapies together. So it's not just one thing. You need you need during the treatment, you need post. There's a whole bunch of things. It can get really complicated though, right? Especially if you don't have all those tools at your disposal. I don't have a photoacoustic, let's say, I do in my clinics, but let's say you don't, how do you do that? And wonderfully, there are some things out there that especially Gemologica have come up with that can really look at those types of skins and say, okay, what is the approach that we can use here. But what are some of the traditional approaches, and give us a few pros and cons of those?
I mean, you've nailed it. I love combination therapies, and I think that is going to be the key to everybody's success, But there have been things that have been used in the past, and I think the biggest thing is hydroquinone. We hear of it. You can still get it in Australia in compounding pharmacies. You can still get it, and the problem is that hydroquinone is really effective at treating hyperpigmentation, but it can create so many other problems on the skin. That ochronosis, that dark purpling, that recalcitrant pigmentation that you were just talking about, how it can actually get worse. But I think a lot of our really traumatic pigmented skin disorders have turned to hydroquinone and its cohort, its sister sort of ingredient, arbutin, in the past, and it's just led to problems. Also, the fact that it is banned in so many countries because of the potential carcinogenic effects, etc., and make it an ingredient that really we don't need to rely on anymore. I think also in the past, we've got lasers and IPL units, and they're good. They have their place. They're phenomenal. But I think the ones in the past, I mean, it's an ever-evolving technology, right? Laser and IPL, and I'm just seeing it go from strength to strength to strength. I mean, when I first did laser training, it was very, very limiting. It was hair removal, and you could only do it on dark hair. But now you've got opportunities to treat the lighter hair colors with lasers and IPL. So I think the treatments that have been around in the past have had their limitations. I think also the formulations in the past, we've got some amazing acids, lactic acid, glycolic acid. We've got all of these things, but I think because of the formulations in the past, they've been very inflammatory on a high Fitzpatrick, and they've created more problems. And so although none of those things are wrong, they had their limitations because of the technology and the knowledge that we had available to us.
Providing professional-grade skincare since 1986, Dermalogica has grown to be the leading professional skincare brand, used by more than 100,000 skin therapists in more than 100 countries around the world. Founded by a skin therapist, their product line grew out of a desire to provide skin therapists with the best-in-class skincare products and education. Powered by the International Dermal Institute, their skills-based training has served a community of passionate skincare professionals, building their skills and breaking new ground in the skincare industry, whilst developing personalised skincare solutions that help clients achieve the healthiest skin they can, not just today, but for life. Dermalogica is the #1 choice of skincare professionals worldwide. To learn more, visit www.dermalogica.com.au today.
Now, today, fast forward 2024, and I think we've got a lot more knowledge and a lot more innovation at our fingertips that's going to enable us to get those results more efficiently without creating that huge potential for post-inflammatory hyperpigmentation.
And in an easier way, if you can't get your hands on a pixel or something like that, how do you do that? Because that is, I think a lot of therapists that are going to be listening to this I do want to treat those darker Fitzpatricks. I do want to do it safely. I don't have the equipment in my clinic to be able to do that. And should we even be using equipment, even the very, very latest things on their own? Which certainly from my experience, the answer is no. It needs a combination therapy approach. And this still the best, most effective is going to be, what ingredients do you put on your skin? What in-clinic treatments can you do? So what is new for treating melanin-rich skins then, and all Fitzpatricks?
Well, there's lots of things. I'm loving, the BBLs and things like that. When you say technology driven, there's some great broadband lasers that are really targeting that pigmentation. But like you say, not every therapist is going to be able to get their hands on a device like that. I mean, even LED, we look at LED and it's so mainstream and it's so efficient. But again, not everybody can get their hands on it. And I think, wanting a something simple but something effective, you can't go wrong when you look at ingredient technology. And you can't just rely on one ingredient And I think this is the thing in the past, I love lactic acid. Love lactic acid. It's great for pigmentation, but it's one ingredient. And what if you're a client that can't tolerate lactic acid? What if you're a stinger? There are just a very small percentage of the population that lactic acid is totally intolerant to it. So then you look at things like glycolic acid. Well, glycolic acid is amazing. It's tiny in its molecular structure. It gets into the skin very quickly. And on a skin that we're trying to keep that inflammation at a lower level, we don't have as much control. Glycolic is rogue. It goes rogue and we don't have control over it as much. So we have to look at ingredients that are really really going to get you those results, but are really targeting pigmentation. I'm absolutely loving azelaic acid. That's an ingredient that's really just coming into its own finally, because it's such a great tyrosinase inhibitor. The other one that we're really starting to see pull forward now is tranexamic acid. It's always been available as a systemic drug, and you can buy it overseas. You can't buy it here in Australia, but you can as a tablet. But there are studies now conducted showing that 5% tranexamic acid applied topically can really reduce that pigmentation buildup in the skin. Another ingredient that I'm really excited about, because I love my peptides, and that's acetohexapeptide 1, which has really been shown to reduce the production and the activity of the enzymes that are involved in pigment production. And by that, we can reduce not only the number, but also the size of the melanosomes. Those packages, the size of those packages and the distribution of those. So those three really excite me. But there are two that have been in our industry for years that we're just starting to sing about. And Steph, I've sung about them with you in the past, but that's niacinamide and retinol, because those two ingredients are just phenomenal. Niacinamide, we see it for pigmentation, but we also see it for sebum production. I think we see it for so much hydration, so many other things. But when it comes to melanin, niacinamide can literally reduce the rate and the acceleration of those melanosomes moving into the keratinocytes. And it's only when you've got that movement that we start to see the pigmentation. So to have an ingredient that literally slows that whole process down, just next level. And retinol. Who can't get their hands on a retinol? Even if you were just starting up your clinic and you wanted just a really basic product range with not a lot of hoo-ha, not a lot of bells and whistles, everybody has a retinol. And retinol totally interferes with that melanogenesis process. So imagine if you could get all of those ingredients in combination. Winner, winner, chicken dinner. That would be amazing, because there are some really groundbreaking ingredients that as therapists don't require a huge amount of outlay. It's that expense, but they get results, and that's what we're looking for.
They get results, and they do it, more importantly, safely and in a controlled way. And I love everything you said. I love the fact that you are so educational. You pull out your ingredient names. You're really talking to the therapists and giving them the choice to go and research these particular ingredients as well. It's so important to give the power to the therapist and the choice to the therapist as well on what they feel comfortable using and what suits their particular demographic and the particular patient that they have in front of them. And so that brings us to then all these ingredients packaged into one. Dermalogica you have incredible labs, you have incredible research facilities and wonderful scientists working for you, and the combination effort there to create products that as therapists, we can really sink our teeth into and use on a diverse kind of patient spectrum. And I feel that with the Melanopro Peel system by Dermalogica, this is such an exciting system. I feel like you've ticked all those boxes. Tell us, why is that system so effective? Why are we seeing such great results?
You know what? It's a two-part system. It's a clinical peeling system that comprises of two-phased system. And when we conducted all our clinical trials, so we are blessed as a company, right? We have a huge research and development team. We're backed by Unilever. So we have all of those incredible ingredients and patents and things to get our hands on. So we are very blessed as a company because we can create that innovation. We also have the ability to run those really good quality clinical trials that are independent, gold standard, blind testing. So we know the results. And when we trialed the Melanoprobe peeling system, we tried it on all Fitzpatricks with outstanding results across the board. And some at the Elevate conference, there will be some before and afters to show you those different before and afters on Fitzpatrick 5 and 6 as well as a 4. But what we see with that is, as I say, a two-phase system. The treatment begins with the technician, with the therapist. Client comes in, has thorough consultation and assessment, and then there is a mask applied to the skin. It's a day 1 peeling mask comprising of ingredients like azelaic acid, tranexamic acid, acetyl hexapeptide 1, niacinamide, there's salicylic acid in there, there's all sorts going into there, and that mask is left on the skin. So the therapist applies it to the client, and then depending upon that client's Fitzpatrick, they then offer advice as to how long that mask is left on for. So if you have a darker Fitzpatrick or a drier skin, you don't leave the mask on for much longer than 2 to 3 hours. Whereas if you have a fairer skin or more oily skin, it can be left on for up to 7 hours. So essentially the client is going to go home with this white mask on their skin. But what happens then is that after that period of time that is advised and recommended, client's going to take that mask off. They're then going to give their skin 48 hours just to calm down. You know, this is the thing. And I think this is one of the biggest tricks, is that we're not obliterating the barrier. We're not creating a huge inflammatory response. And I think that's why we're getting such great results, because what really then starts to happen is on the 3rd day, the client applies a product called continuous resurfacing cream. And this contains all the same ingredients that were in the mask with the addition of glycolic and lactic acid. And so it's bumped up. But in there are also anti-inflammatory agents. So there are ingredients like licorice, for example, that just keep that inflammation at a beautiful, it's not full, we're not obliterating the skin. And that continuous resurfacing cream is really now just going to be applied for the next maximum of 6 weeks, 42 days, 6 weeks. There is a little bit of a period just at the start. The first 7 days are a bit, the therapists are keeping in touch every single day. How is your skin? Because the skin obviously is going to feel quite hot. It's going to feel quite sensitized. But after day 7, and the flaking starts to happen, the shedding starts to happen, and then around day 10, skin just starts to look absolutely phenomenal. But because we've got all those anti-inflammatories, and because we're not smashing the skin, we're just introducing those key ingredients, we're just getting such amazing results.
This sounds like an actual dream. And you know what I love about it is the time release. It's that you can control the intensity of it, not even the intensity, but the depth of it, I suppose, for a lack of a better term, over a period of time. So you actually have much more control, because it is quite scary when you're putting on quite an intense peel and you've got minutes, to work with. You can't really regulate it. It's like the effect in somewhat slow motion, so that you can then go, okay, let's build this out over 3 hours and then remove it, because obviously you're a darker Fitzpat, or you've got a higher inflammatory response, or you're immune compromised, or whatever the reason may be. Or, wow, you've got a great tolerant skin, you're the perfect candidate, let's stretch it out a little bit longer. And then you're also giving the choice to the patient to know their intensity, because, we have so many nervous patients coming in, and sometimes the first time they're like, I actually just want to see what's going on here. Give me a milder effect. So you're giving control to the therapist. You're including the client in that journey of actually controlling how intense that's going to be. When they do come home, a question, and say, would there be any reason for them to leave it on longer or wash it off sooner than the therapist has indicated? Or is it completely in the control of the therapist?
No, I think, we have those guidelines. And obviously for ultimate efficacy, the longer that mask can be left on the skin. With a darker Fitzpatrick, it's going to take longer to get the results, because we create that inflammatory response. But what we do once we've applied the mask is we actually stay with the client for a good 30 to 45 minutes in that initial phase, just to make sure that there's no irritation. Obviously, if the client goes home and a few hours later, they're just really not tolerating it, first port of call would be to call the therapist, but the therapist would always advise, you know, what if it's really not comfortable, then absolutely you take it off your skin. The continuous resurfacing cream, when they move into that phase, if at any point you find that your skin is really not tolerating it, you can stop. You can take a couple of days. You can give your skin a bit of a breather. You don't have to apply it 3 times a day or 2 times a day. Maybe you only apply it once a day. We still see the results. It's just that they obviously take a little bit longer. So, you know, for those clients, it's just, you know, I want to get that result. I want to get it now. I want to see it in 6 weeks. You can, but if you're not tolerating it, then maybe it's going to take you 8 weeks or 10 weeks, but you're still going to get the results. We've got to work with the skin's barrier. And I think that's what's really important. You know, when we're ascertaining how long we're going to leave that mask on and how many days a week, how many times a day you want them to put the cream on, how is the barrier integrity? That comes back to your assessment of the skin as well. Like if the skin is dry, and I think I alluded to that, if there's a lot of dryness there, we don't want you leaving that mask on for too long, because otherwise those ingredients could potentially create that inflammation. So it all comes into a beautiful treatment where we work with the client. And ultimately, yeah, if the client's experiencing a sensation that they're not comfortable with, we want you to stop.
I love that you build that flexibility in, and it's only going to be a small percentage of people, but therapists always, the first go-to question is, what if, you know, what if? And we always care about that very small percentage of people that's going to be the what if patient, and you've built in complete flexibility and control there. It's such a beautiful system. I think we really have needed something like this for a long time. I think it's revolutionary. And I also know that you've got so many other supportive products within the Dermalogica range to prep their skin, to support their skin, to soothe their skin, you know, so it's a complete journey. It's not just, hey, you know, this is the one and done solution, right?
Oh, no. I know, you know, we do actually advise therapists that are wanting to work with the melanoprobe healing system to make sure that they have prepped the client's skin. It's not just somebody walking in off the street and slapping a mask on their face. No, that's not going to end well, right? So we want to make sure that they can tolerate levels of acids, like our Pro Power Peel, for example. Can they tolerate those acids on the skin? And then are they a suitable candidate for melanoprobe healing system? It's not for everybody. And I think that's the thing, you know, we're never going to be that brand that says you have to do this. It's what is in your client's best interests and what's going to get them the results that they want. But what's great about the melanoprobe healing system is it's affordable. So for therapists just starting up that want something for that demographic, it's affordable, and it's affordable for clients too. Their treatments have been quite expensive, whereas this is actually affordable. And I think that's a good option too.
And even if you're not just starting out, this is quite an advanced system as well. And I would suggest if you're an advanced therapist, you use it in combination with the other treatments that you do have. Just because you've got all the wonderful, you know, Duvalakis and lasers in your clinic doesn't mean that you don't need this. It really is something that's a staple and that you can use in combination. So whether you're starting out or you're an advanced therapist, it's something you really should have a look at the conference. Now, 20 days or so. Yay! It's so exciting. But you're actually going to be presenting all about pigmentation. You're going to be going in depth. So today was a sneak peek at what we're going to be seeing at the conference, which is going to be so exciting. I literally can't wait for this presentation. We're going to see some dramatic, you know, before and afters and some wonderful reveals that you'll have on the day as well. We're all so excited for it. Thank you so much for presenting on the day. Are you totally excited or what?
I can't wait. I can't wait. As soon as I saw Elevate was on, I booked my ticket. I loved the conference last year. I thought it was fantastic, and I know this year is just going to be even more exciting. So I can't wait.
Yeah, well, we can't wait to have you. Thank you so much for being such a wonderful supporter of our industry. You know, the education that you provide, the time that you give, and how you give back to the industry is really very admirable. And, you know, Dermalogica, close to our heart, one of our very, very important foundation members. So thank you so much again for coming on the podcast and giving us this wonderful information today.
You're welcome. Thank you for having me. I do always look forward to our chats, and I can't wait to see you at Elevate in a couple of weeks' time.
You've reached the end of another episode of the Beauté by ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.